In this tutorial, I'm going to be giving you a brief demonstration of how to document a patient complaint. First, I'm going to start by selecting a patient from our appointments list. Then I'm going to choose to create a new document. The type of document is a patient complaint. I'm going to choose OK. Here we have our patient encounter window. Here on the left side you can see the patient's past history, such as medications, allergies, problems list, and history. On this next banner is the visit details, which I can click to expand, which will show the patient's details as well as details of the visit. And I can hide that. And here in the top bar you can see a list of buttons. These are going to go in order of your workflow. So we're going to start here with our complaints. We're going to enter a complaint. For this example, I'm going to use headache. I'm going to click to add it. I'm going to put a duration of 10 days. Okay. Here in the general section, I can add more details to the complaint, such as location, onset, number of episodes, when the symptom occurred, timing of the symptom, prior history of the symptom, or prior treatments for the problem. Next is a review of systems, and you'll notice that whenever I entered the complaint, this template came up with all of these selections. These templates are very easy to edit. This one we've pre-made for headache, as you can see. So now I'm going to add some relevant systems. I'm going to choose no cancer, no fever, no lupus, yes sinus infection, no blurring of vision, no nausea. Next, I'm going to choose our aggravating factors, relieving factors, radiation, past history, and past family history. Now I'm going to choose update and OK. You can see here in our note that everything that we've just done in the complaints window has been added here in sentence format. Okay, so next we're going to go to our review of systems. Here you can see our list of systems, so we can choose which system we want to review and choose yes and no. Okay. In here on the right, there's a banner that says final text. If we click that, we can see that as we're adding these selections, our final text is being generated in a sentence format. We also have some options here. We can choose yes for all, no for all. We can choose some yeses and choose no for others, or we can clear them. Okay, and again, everything that we just did is being added to our note in sentence format. Next, we have our past history. Here, we can add to the patient's past history, edit it if there's a change in allergies, medications, problems, surgeries. Okay. Next is our vitals. Here we can add new vitals: temperature, pulse, blood pressure, respiratory rate, height, weight, okay. Okay, and the vitals have been added to our note. The next button we have is the Load Exam button. Here we've set templates for all these organs. We have our brief examination, detailed examination, and comprehensive examination. So we have the option to check these to add them to our note, or we can go here into our exam tab and do it by the organ. For example, I'm going to do mouth and throat. Here I can choose some of my findings. Tonsils are normal. And here at the bottom we have our templates. We have our brief, detailed, and comprehensive. Okay, and we can choose as many of these as we like, and that's going to add to our note. Okay, next I'm going to go to assessment. Okay, and here again we have the template for headache, which can be easily edited. So here I'm going to add a diagnosis. I'm going to choose any tests that were done. I'm going to choose some things for plan. And some medications. Okay, next I'm going to go to my CPOE where I'm going to do all my ordering. Here I can write prescription medications. I can also go to our e-prescriptions and prescribe from there. And here I'm going to do all our lab orders, and I also can use the e-lab. Here's where we're going to add our ICD codes. By clicking on favorites, it's going to bring up a list of all our favorite ICD codes. And from here I can just click to add a couple of these. Okay, and there they are. Next is our CPT codes. I'm going to click on Superbill, and that's going to bring up a copy of our Superbill. And from here I can click on these codes to add. Okay, you can see the CPT code is added here. In this next panel we can add referrals, and in the next one, education handouts, we can add files for information that we want to give to the patient. Okay, and now we're finished with our exam. So I'm going to choose finish. This is going to bring up our completed note. As you can see, everything that we've done from the complaint all the way down to the CPOE has been added here. And on the left is the patient's past history. And from here we can sign. It's going to ask if we'd like to sign the document now. Yes. And now we'll close everything off. That document has been signed and completed.